Hi, we're watching a traumatic cataract surgery. A young boy, 7 years old, was hit with a rock, left him with a traumatic cataract and some iris sphincter tears. And biggest concern for me with this case is getting this capsulorhexis. As you know, young kids, the capsule is very stretchy. I used Trypan Blue here for two reasons. One was to change the consistency of the capsulorhexis to make it tear a little more like an adult rhexis, and also to make sure I didn't lose my view during the rhexis creation. It was very stretchy, but successfully created. Lens itself is very soft in young kids, so I just used a bimanual IA to remove the lens material. Luckily, that posterior subcapsular cataract peeled off very easily. And although I was concerned about it, I didn't see any zonular instability issues, but I still placed a capsular tension ring just in case there was some unrecognized instability, and also to possibly prevent some capsular phimosis. I did opt to put a lens implant in. Our target refraction here was plus 0.75, and then added a miotic agent. And once the pupil comes down, you can really see where all those sphincter tears are. Now, some of the iris was functional, so I didn't want to make a Surclaw suture, so I just simply brought together some of these sphincter tears to make the pupil a little more physiologic in size. And I wanted to make sure that when he was constricted, the iris or the pupil was smaller than the optic size. And on exam in the office, he was probably a little bit large. So here we're just bringing 2 or 3 of the sphincter tears together, and you can see as we go the pupil size is getting a little bit smaller and smaller. The first sphincter tear I repaired using a sliding knot. The second one, I was able to externalize the sutures through my phaco incision and then just simply pull the knot in the eye and tie the knot half in and half outside the eye. Kind of a mechanical type suture. Then cutting the sutures inside the eye with a micro scissor. At the end of the case, the cataract is gone, the iris is put back together, and the patient did very well. Thank you very much for watching.